Hello folks, welcome back to the C Morning Show. Now we are up for our first talk show. Now the Indonesian Ministry of Health will provide free medical checkups for Indonesian citizens on their birthday starting in 2025.
That's coming soon.
Now the free health screening program is a birthday gift from the government to the public, conducted on their birthday to ensure early health monitoring. The screening can potentially detect up to 75 diseases and is available to citizens of all ages, starting from toddlers to seniors over 60 years old.
All right, so these free medical checkups will be provided at local community health centers or puskesmas and schools as well, based on age categories. Now, the Ministry of Health is collaborating with the Directorate of Population and Civil Registration to ensure the success of this new upcoming program.
So when is your birthday, Paul?
I'm glad you brought it up.
Yeah.
It's January the 10th, so if this program is implemented early next year...
Yeah, I bet you have a lot of questions. Okay.
Honestly, I do not get medical screenings enough. We all should be getting medical checkups once a year. So I think this is actually perfect because it's on your birthday. So it's something that is you can actually do and you should do every year.
And you are really excited about this talk show because your
happy
birthday is coming up. So, yeah.
Yeah, to find out more about this program, we're now going to connect live with Ibu Widiawati. She is the spokesperson for Indonesia's Health Ministry. Good morning, Ibu. Thank you for joining us.
Good morning.
Good morning. Now, this is good news to all of us Indonesian citizens. So we have a lot of questions on this upcoming program.
So let's get started. Let's first find out, Ibu, how can citizens register for this free health screening program?
Okay, good morning, Mas Paul and Rafi. Thank you very much for being invited to discuss for this morning. Okay, citizens can be registered for the free health screening program through the Satu Sehat mobile apps.
Okay.
Once again, Satu Sehat mobile apps. So they need to install it first. Once registered, they will receive notification for their screening appointments 7 days before. Once again, notification for the screening appointment 7 days before, 1 day before, and on their birthday, prompting them to visit the nearby local health center or other facilities that collaborate in the program for their screening. If there are citizens who do not receive notifications, have not registered, or do not have access to the app, they can directly visit the puskesmas to participate in the screening program.
Okay, so by the way, I have the Satu Sehat application.
Yes.
I remember, I think we were using this during the COVID-19 days as well. So if you would likely already have this on your phone, that's what it looks like. You just have to log in and again, 1 week advance notice to do
Okay.
Satu Sehat mobile apps. Install it first, Mas Paul and Mas Ravi.
Yes. Will
you have Satu Sehat mobile apps?
Yes, I already do, right?
Yes,
here.
already
Perfect.
do.
Good.
The COVID
It's
days.
good.
Big smile on her face. Okay, so Ibu Widiawati, what are the key differences between the birthday health screenings and the one being provided by the National Health Insurance or JKN program?
Okay, the difference here between the birthday and GKN program. There are several differences between the birthday health screenings and the GKN screenings, from the number of examinations, screenings target, and how it is carried out. There are 14 GKN screenings that are also part of birthday health screenings, which has a larger number of screenings. The target of GKN screening is GKN participants, while birthday screenings is for the entire community. Other differences is the GKN screenings carried out when people go to health facilities that collaborate with BPJS Kesehatan, while birthday screenings are conducted according to one's birthday. That's the other difference. And screenings in GKN are preceded by health history screening and will be continued with laboratory examination is found to be at risk, while birthday screening is directly carried out by laboratory examinations.
Okay.
That's the difference between birthday and GKN programs.
Okay, so we do know that there's usually a little bit of time after we do any sort of medical checkup or screenings in order to get the results. So how long is the estimated time for the participants once we do our screening in order to receive our results?
Yes, the time it takes to receive the results of a screening varies for each group, as the screening services provided are tailored to the specific risk factors of each group. Therefore, the duration can differ based on the unique health needs and risks associated with each category.
Okay, that would make sense because,
Yeah.
like, for example, I'm
Yes.
a bit older than Ralphie, so I'll probably be screened for different things as well rather than you, right?
Just maybe.
Okay.
So we still have more questions here, Ibu Widwati. So if an illness is identified during a screening, can individuals continue their treatment through a referral, or would they need to start fresh at a local health facility like a community health service?
Yes, for the result of the screening will be categorized as either normal or abnormal, and follow-up actions for abnormal result as follows of, for example, first, if the screening results are inclusive, further examinations will be conducted at the local health center, puskesmas, and then if a diagnosis is confirmed and can be managed by the puskesmas, treatment will be provided there. And other is if the diagnosis is beyond the puskesmas capabilities, a referral to a hospital will be made. And the last is further specialized screening is required. The individual will be referred to a hospital. Additionally, for screening result, wherever normal or abnormal, relevant health education will be provided to ensure individuals are well informed about their health. So once again, the health education is very important for society.
Okay. So let's talk a little bit, Ibu, in regards to who can get these screenings. We mentioned that this is for the entire community, it's for all ages, but who exactly qualifies? Is it open to all citizens, regardless of their socioeconomic status?
Yes, all citizens are entitled to benefit from health screening services. All citizens,
Okay.
regardless of their socioeconomic status. Once again, all citizens, regardless their socioeconomic status, and the government has ensured that the program is inclusive, catering to the needs of various groups. To make this more effective, the program is divided according to life cycle. Number one is newborns, infants under 5 years old, and preschool children. The second is school-aged children and adolescents. Third, adults, and fourth is elderly. The categorizations helps in addressing the specific health needs to each group,
Right.
ensuring that everyone receives that appropriate care and attention they require.
Okay. And make sure, by the way, if you have little ones, make sure they have their kartu identitas anak.
Yeah.
I knew that was when
Yes,
our kids were
yes.
born. We made sure that
Yeah.
we have that because that makes them eligible for any sort of
Those were the
services.
pink ones.
Yes.
Yeah, the little pink cards.
Yeah,
Yeah, all
pink
my
cards.
kids have one. So it's very important if you want to be eligible for BPJS services as well.
Yes.
Perfect. Okay, so Bu Widwati, this is a really nice program, and we are all in of support of that. But has there been a proposal from the Indonesian House of Representatives to actually limit the service to unprivileged citizens? Underprivileged citizens.
Underprivileged citizens. Okay. The Indonesian House of Representatives fully supports the implementation of a free health screening program through birthday health screening. There is no direction to limit recipients of services. All levels of society are entitled to the same health rights.
Okay. So, Ibu, obviously with this new program being implemented next year, there's thousands and thousands of people celebrating their birthdays every day, basically, throughout the year. So there'll be a higher demand for services due to this new program. Will there be a corresponding increase as well in the number of either healthcare providers at the community health centers or even integrated health services posts, perhaps?
Yes, thank you. Since the launch of the National Health Transformation Program, especially in Pillar 1 related to transformations of primary health services, the Ministry of Health has been working to ensure that its primary healthcare infrastructure and equipment needs are properly met, including the building and upgrading of new primary health centers and the provision of necessary equipment. In anticipations of the increased demand for services resulting for the programs, the Ministry of Health has constructed new and renovated primary health center this year and plans to increase the number of primary health care facilities to be constructed by 2025. The provision of primary health care facilities and infrastructure will be followed by an increase in the supply of medical equipment and, of course, the training of primary healthcare workers.
Okay, that's perfect because, I myself have noticed as well in recent times, the puskesmas near my house has been vastly improved as well to provide more services as well for the local community. Ibu, this is a wonderful new program and we cannot wait to see the implementation of this, of course, in order for us to better be aware of our own health, especially doing these screenings. Ibu Widiati, thank you so much for joining us this morning. Really appreciate your time and good luck with the program next year.
Thank you very much. Stay healthy.
Oh, amen. Thank you. You too. Likewise. So there you go. Ralphie, by the way, when is your birthday?
Oh, my birthday is still on May. So
Okay, I will
tell me
let you
about
know
it.
how it goes.
Yeah, so tell me about it, okay?
Again, the important thing to take away from this, guys and girls and men and women out there, please do download the Satu Sehat application on your phone in order to be eligible for this as well. And remember, there's a 1 week time before. So in my case, on January the 3rd at the latest would be the time I would register for the appointment and then I'd be able to go.
So I really can't wait for the 11th of January episode of the C Morning Show. And Paul will keep us updated on that, okay?
I will. All right. We're going to take another short break here. We're at the halfway point of our show. In case you did join us late, don't worry. We're going to share with you all of the latest happenings from around the world when we return. Stay tuned.